Hello, everyone. My name is Manny Ramos, your host of Rise Up, Real Issues and Stories of Every One of Us podcast. Our guest for this episode is Dr. Nagtalon Ramos. Dr. Jamil Nagtalon Ramos is an assistant professor of nursing at Rutgers University, the State University of New Jersey. Her research interests have been fueled by her clinical expertise in women's health and her cultural roots. As a third-generation nurse, born and raised in the Philippines, she is passionate about exploring the Filipino-American experience and investigating sexual reproductive health disparities. She's the recipient of the Provost Fund for Research Catalyst Grant Award for her research on the sexual and reproductive health of Filipino-American college students. Dr. Nagtalon Ramos is a board-certified women's health nurse practitioner in postpartum care and well-being, contraception, lactation, and sexual health. In 2018, she was inducted as a fellow of the American Association of Nurse Practitioners for her outstanding contribution in advancing nurse practitioner clinical practice and education. She was recently a Philippine Nurses Association of New Jersey Excellence Awards honoree for Nurse Education of the Year. Dr. Nagtalon Ramos is an award-winning author of Maternal Newborn Nursing Care, Best Evidence-Based Practices, and has co-authored the Midwifery and Women's Health Nurse Practitioner Certification Review Guide, a vital resource for midwifery and women's health nurse practitioner students and new grads. All her books combined have sold over 12,000 copies worldwide. So as we start this second segment of our inaugural podcast of Rise Up, I'm going to bring up that the CDC has issued its strongest guidance to date against COVID-19. The latest guidance on COVID-19 vaccination is recommended for all people 12 years and older, including people who are pregnant, breastfeeding, trying to get pregnant now, or might become pregnant in the future. The guidance comes as more than 250,000 cases of COVID in pregnant women have been reported, 22,000 of whom were hospitalized. 161 pregnant women died, according to the CDC. Yet, less than a third of pregnant women have been vaccinated. It's well established that pregnancy is also considered an underlying health condition that are at risk for complications of COVID. Overwhelmingly, these complications have occurred in women who were unvaccinated. So welcome, Jamil. How are you?
How are you? Thank you so much for having me. I'm very excited to, have this conversation with you all. And especially in this inaugural podcast, I'm very excited to be part of this.
That's good. So, nice to meet you. I've not met you before, Dr. Nagtalon Ramos. But why did you want to become a nurse?
That's a good question. I teach right now students from, undergrad students, and it's a conversation we have all the time about why did you want to, in fact, their first paper is, why did you want to become a nurse? I actually knew that I wanted to be a healthcare provider. I just didn't know exactly what when I was growing up. My grandmom is a nurse. And she actually, Lydia Venzon, she was a dean of a nursing school in the Philippines. When I visited her in 2017, she was in her 90s, and she was attending a nursing conference and presenting at a nursing conference. And I said, Grandma, can we visit you? She was like, nope, I'm at a conference right now. I'm busy. So I have grown up with my grandma, visiting her at Quirino Hospital. She was the head nurse there. And I remember going before HIPAA, going to her office, and she would bring me to, all the different wards and visit patients. So I feel like it's in my DNA. And same thing with my mother. She's also a nurse. She's still a nurse, actually, at a pediatric ICU at St. Joseph's Hospital in Paterson, New Jersey. And she's hoping to retire next year. She keeps saying that every year, though. So, but I feel like it's in my DNA. And so my freshman year at Rutgers, I I decided to become a nurse and, go into nursing. And I knew that that was something that, a career that would be very fruitful for me, that I can really help other people. And again, I've grown up in that environment, and I've seen how much my mom and my grandmom have sacrificed to help others. And it was truly inspiring to see that.
So, Dr. Nagtalon Ramos, what made you go into this field of specialization? I mean, nursing is a wide,
Yeah.
field to be in, but why did you decide to specialize for women's health?
Health, yeah.
What made you go choose that field?
Yeah. So I always knew that I wanted to go in a specialty that was helping women. I didn't know exactly what that would be. I knew I wanted to be a healthcare provider. I knew I wanted to help women in the community. And becoming a women's health nurse practitioner combined both of that. And so when I was a senior in college, I did a rotation, my leadership rotation in a women's health, with a women's health provider, one of my mentors at school. And we did home visits for high-risk pregnant patients. And I just said, this is it. This is what I want to do for the rest of my life, is to take care of women, specifically women in pregnancy, women during that early years, I would say. So being able to provide sexual and reproductive health. And it was something that I felt very, something that woke me up in the morning, and really to this day, 20 years in, still very much have the passion to do that.
I see. So with the expertise you have with women's health, and you know about vaccination hesitancies, so what should pregnant women need to know if they're hesitant to receive it?
It's a good question. I think we need to actually take a step back and acknowledge that women during pregnancy want to do the best for their babies. And they just want to make sure that they have the healthiest of pregnancies, that they're going to have a healthy newborn. And so I think part of that is the hesitance for this vaccine, because a lot of my patients, a lot of my colleagues, or friends and neighbors and other moms who text me and email me or call me up and say, I don't know about this. I can't decide whether or not I should get this vaccine. I feel like, there's a lot of different reasons, right, that we hear. There's not enough research. It's brand new. It was too quick. All these different things that they name that could possibly contribute to their hesitancy getting the vaccine. So how I approach that is I give them the facts. And, as a nurse, right, we do shared decision making. I present you the facts, and I will give you the risks versus benefits. I'll give you, what we know about the vaccine, which Manny had said earlier that only a third of pregnant patients, pregnant patients have been vaccinated. That means like most of the pregnant people out there are unvaccinated, and they're at a higher risk of getting sick if they have COVID. So they're at a 70% increased risk of death when they have COVID and being pregnant. So those are the facts that I tell my patients. And again, anyone else who, on social media or again, neighbors or mom friends that text me and say, I'm pregnant, or my friend is pregnant, or or my wife is pregnant. What do I do? How do I make a decision getting the vaccine?
I see.
Now, Dr. Nagtalon Ramos, you're also a lactation consultant. And this podcast, our viewers won't be just nurses. So I'm sure that, their family perhaps and friends would be joining them when they watch this podcast. So for our audience, could you tell us, there will be two questions I have. Could you tell us what is a lactation consultant? And the second question is, for the women who are breastfeeding, should they be worried about getting the COVID vaccine?
Yeah. So I'm a lactation consultant, which means that I'm an IBCLC, an internationally board certified lactation consultant. So I feel very strongly about being able to provide the best services for my patients, and having that knowledge and tools and being certified as a lactation consultant. I wanted to have that knowledge to be able to provide for my patients, especially being Filipino American. I feel very strongly that as a lactation consultant, as a women's health nurse practitioner, I would be able to provide that service for Filipino American and increase our health, our sexual and reproductive health overall. And that's why, as a researcher, that's my main focus of my research is sexual and reproductive health in Filipino American women. So as a lactation consultant, I'm able to provide breastfeeding support for patients, the patients that I see at the hospital. So I'm actually a hospitalist, which means I primarily work at the hospital. And it's a position that we developed 17 or 18 years ago with an attending physician that I worked with. I was one of the first two in the department. And so we created this position to, primarily manage the care of women in the hospital. And while they're immediately postpartum, they need lactation help. And so I wanted to be able to provide that comprehensive and holistic care for my patient. We do have lactation consultants in the department who are there, I think 24/7 now we have coverage. But I still wanted to be able to, when I'm seeing a patient, be able to, take care of them comprehensively, and be able to support them, answer their questions, and be, a better provider that way. With your second question regarding breastfeeding and the COVID vaccine, we definitely, the American College of Obstetricians and Gynecologists, ACOG, that's our professional organization for women's health. They recommend that women who are breastfeeding, again, pregnant, before pregnancy, pregnant, postpartum, breastfeeding women or patients should get the vaccine. We know that there's evidence of being able to provide that antibodies from the vaccine to the baby by getting the vaccine as a pregnant person and through lactation. So there's many different, if someone is not comfortable getting the vaccine during pregnancy, again, we have that conversation again in the postpartum period. So in our hospital at Penn Medicine, we actually offer the COVID vaccine immediately after having the baby, during that postpartum period prior to leaving the hospital. So it's just another way of providing that service to the patient. So think about a new mom, right? The new mom just had a baby, if they go home, for them to think about, let me schedule this vaccine, let me make arrangements. Maybe they have other kids for a babysitter, when they, make arrangements for transportation to come back to the hospital. They may not want to bring their infant back to out in public. So they may be hesitant to bring their infant out to make that, to get a vaccine. So having that service prior to leaving the hospital, it's actually, a really good way to provide the vaccine for postpartum patients. When we give that first dose, we schedule them for the next dose so that it's already scheduled even before they go home. So lots of different, again, points of time that we can do that. And we definitely recommend getting the vaccine during that lactation period.
Oh, I see. So, does vaccine cause fertility problems in women or men?
That's a good question, and a very, very common question that I have heard all over social media. I have heard from many patients who have asked us whether or not it causes infertility. There's no evidence for that. And actually, again, the American College of Obstetricians and Gynecologists, the Society for Maternal Fetal Medicine, those are the premier organizations for women's health have recommended the vaccine for all women, especially women who are thinking about getting pregnant. There's no evidence that it causes infertility later in life. In fact, my 14-year-old daughter, as soon as she was eligible for the vaccine, I signed her up, we were in line. And when I posted it on Facebook, I got, a flood of messages from other friends, mom friends, and, colleagues, and a lot of people who were asking that question and were concerned about fertility issues in the future. So I said to them, I'm very confident about the recommendation. There's no evidence that the vaccine causes infertility.
Oh, good to know.
So, Dr. Nagtalon Ramos, for the patients that you have seen, what is the atmosphere there, and what has been, especially to for those who haven't received the vaccine, how are they receiving this when you talk to them about getting a vaccine? How has that experience been?
Yeah. So it's interesting because we test all our patients coming into the hospital for COVID. We do a COVID test on all our patients coming in. And so I actually have had a group of patients, right, that are asymptomatic. They come into the hospital, they're just thinking they're pregnant, they're going to have a baby, and then they're in and out, have their baby in and out of the hospital. But then they test positive and they're completely surprised. And, they're like, wait, I don't have symptoms. How can I have COVID? Right. And so I have the conversation with them actually. And I say to them, I remember this one patient that said, I don't understand. My whole family is so surprised that when I told them I'm positive, when I came in the hospital, they tested me and I was positive. And she said, my whole family was so surprised because I isolated myself for, the last, month of pregnancy. And I isolated myself. I didn't go anywhere. And so I'm surprised that I have COVID. And I said to her, okay, so did you have a baby shower? And she said, yeah, I had a baby shower at my house, right? And I said, okay, so did you have visitors come to your house for your baby shower? And she said, yeah, of course, it's a baby shower. And so, I think sometimes we do take precautions, but we're not thinking, in a bigger way, right? Of, okay, so she didn't have a grand baby shower at some restaurant, but then she had a baby shower at home, and then all these people came over and possibly exposed her to COVID. Nice. So, having that conversation and taking that opportunity with our patient, with that particular patient, and saying, okay, so you're thinking about that, right? Exposure could happen at any point in time. So when people want to visit your baby at the, at home, yes, you're not bringing your baby outside in the public, but think about also the people that could possibly be visiting your baby at home. And, and protecting yourself and your baby, especially that first month, right? When the baby's that immunity is not completely well formed yet. You want to protect your infant as much as possible. So you don't want to expose the infant in public, in crowded spaces. And also thinking about, again, that balance of mental health, so if they live in a place where they could go outside, perhaps, walk around the block if it's, it's a safe community and it's not, it's not crowded, or maybe go to a park and away from people wearing masks. They can still possibly do that, but going to a birthday party, right? We're Filipinos, so I know in my family, my husband has 38 first cousins. So we have there's a party every weekend. It used to be before COVID, right?
Yeah.
And so I'm still very cautious in different ways, in terms of, being able to attend those parties or attend gatherings with family members. And actually saying, my healthcare provider told me that I should be protective of my family. And in our community, we're a very collectivistic community, right? We want to be able to say like, pakikisama, right? Like you want to be like, yes, of course I'm going to be there, right? But actually saying like, because of COVID, I can't bring my baby, or I can't be there because I don't want to expose myself. I have a newborn. Yeah.
I want to go back to the conversation related to your lactation nurse, and for women who decides to breastfeed when they leave the hospital. What is your success rate in making sure that they get their COVID vaccine?
Oh, at the hospital, you know what? I don't have those numbers at my particular hospital. I don't remember. Yeah, I don't remember recently what our numbers are. But we do offer it. So it's part of our discharge in different levels. So the provider, the medical team, the residents and attendings, and then the nurse practitioners and the physician assistants, when we see our patients, even at admission, when they come to the hospital, we test them for COVID, and then we also we say to them that vaccine is offered for you before you go home. And then the nurses also, during their discharge teaching, talk about having the COVID vaccine available for them. So it's actually a really cool process that, we've developed in the last month or so, I believe. So I don't know if we have numbers yet, because it's fairly new service that we provided in our hospital. So it's kind of neat, though, that it's something that, again, we were one of the first units in the hospital that were able to offer that before discharge.
I know. I just tried to remember when without the COVID yet, when I was a CNO, we were having a hard time convincing mothers to breastfeed. So I just wanted to see how the correlation of now it's COVID, how are they going to get their vaccines? Anyway.
So, Dr. Nagtalon Ramos, what do we know of those pregnant women who have become infected with COVID? I've heard some have ended up in ICUs. How is that situation?
Yeah. So if you are pregnant and you get COVID during pregnancy, you have a higher risk for preterm delivery. There's a higher risk for admission to the NICU of your newborn. There's an increased infant mortality, and the disease may be more severe. So it's not just you that may be affected, but your baby might be admitted to the NICU for a longer period of time. Again, mortality and morbidity is higher. There's a twofold increased risk of being admitted to an ICU if you are pregnant with COVID. So thinking, the medical part alone is already distressing, but thinking about, again, we're nurses, right? So we think about the holistic approach, how that affects mother-baby bonding, right? So if someone is severely sick with COVID, that baby may not be able to visit mom. And thinking about, again, logistics. So usually our nursery is in a different part of the hospital than the ICU. And then thinking also about the team and how that affects the team. So a nurse will be assigned to the mom who has COVID, but then, we have to coordinate having the baby visit mom, if that is even possible. And then having a support person, who's that support person and who will they be able to visit baby and visit mom because it's a COVID unit? There's lots of logistics involved. When you think about the real nuances of having a mom with COVID in the ICU, or even having a mom who has COVID and is really sick in a postpartum unit. There's a lot of stressors that happen for the family unit, and also the nurses taking care of them. We want to make sure we're taking really good care of our patients, but we think about the pregnant or postpartum patient and the baby as a dyad. Because if a mom is obese or has asthma, has diabetes, they're an even more risk for disease when they have COVID and they're pregnant. So someone who may not be at a high risk, of getting COVID, but once they are pregnant and they have COVID, they're in a different level of risk. Mm-hmm. So, just a healthy adult getting COVID may not be as high of a risk in terms of morbidity and mortality, but once you're pregnant, you're in a different level.
I see.
Wow.
My next question to you, Dr. Nagtalon Ramos, is more not granular as it relates to women's health, but it's more of a 40,000 feet about research. So I just want to ask you about implementation of research into practice. Did you have any challenges or opportunities with that process?
So not related to COVID, but currently we have this really neat program, texting program that we have, that one of my colleagues, Dr. Adi Hirschberg, had done the research a few years back. We were seeing that we had a lot of patients who were not returning for their postpartum follow-up visit. So, which means after they have their baby, they go home, and we want them to follow up in 4 to 6 weeks, especially those who have blood pressure issues. And we have many patients who have blood pressure issues, whether it's chronic hypertension or gestational hypertension. So she did this research on doing a texting program, which means instead of a patient coming back to us, again, when we talked about someone who's going home and having them come back, thinking about logistics, newborn baby, other kids at home, access to coming back. She did the research in giving them a blood pressure cuff to take their own blood pressures at home and texting us the results. And it goes into this computer in the system, and it tracks all their blood pressures. If there's any blood pressure that was concerning, they get followed up. And so it's kind of neat, thinking about innovation and how our patients are very savvy with texting and using that as a tool, backed by evidence to have them follow up that way. And also giving the patients their own agency to be able to track their own health, right? Take their own blood pressures, and be part of that. Instead of just a passive passenger, I guess, of their health, but instead they're active members of that whole, system and unit.
I see. There you go.
Well, we thank you for your time and expertise, Dr. Nagtalon Ramos. I'm sure, those were the most frequent questions that we've been getting about the COVID vaccine, especially in that population of women. So thank you. I hope and I'm sure that with the discussions we had today, we were able to clear up a lot of those questions that they had. And the hope is that, we could reduce that hesitancy to get that vaccine and make sure that they will be healthy. So thank you. And that is all that we have for this episode. I want to thank our guest, Dr. Jamil Nagtalon Ramos, and my co-host, Mindy Ofiana, our director and producer, Rodney Cajudo, and our executive producers, PNAA President, Dr. Maria Garcia Dia, and our PNAA Executive Director, Carmina Bautista. Join us every Wednesday here on Rise Up. Until then, keep on rising. See you next week. This publication was made possible by Cooperative Agreement CDC RFA IP 21-2106 from the Centers for Disease Control and Prevention of the U.S. Department of Health and Human Services. Its contents are solely the responsibility of the authors and do not necessarily represent the official views of CDC HHS.